Good morning, ladies and gentlemen. I'm Rachma from Diploma 4 Dental Therapy, and I'm looking forward to talking with you today about the chronology of losing tooth due to dental calculus. Before I start, did you know that dental calculus cannot be removed by brushing the teeth? Dental calculus can be removed by the instrument called scaler, and the instrument can be used by dentists and dental therapy. My goal today is to help you understand about tooth loss caused by dental calculus. The title of the essay is Dental Calculus as a Cause of Tooth Loss. The outline consists of three parts. First, introduction of the essay. Second, body of the essay consists of literature of dental calculus and oral hygiene index simplified. Second, explanation dental calculus resulting in tooth loss. Third, prevent the development of dental calculus. And last is conclusion. I will begin by discussing the introduction of the essay. We all know that oral hygiene is an important part of oral health that must be maintained every day. Dental calculus index is one of indexes observed to determine the status of dental hygiene. People who have high score of oral hygiene index simplified will be more risky to have losing tooth. The body of the essay contains first, literature of dental calculus and oral hygiene index simplified. Second, the process and the impact of untreated dental calculus resulting in tooth loss. And last is the effort to prevent from development of dental calculus. And moving away from focus on body of the essay, first section is about dental calculus. Dental calculus is hard deposit formed by calcification of dental plaque that adhesive on the tooth, composed of calcium phosphate mineral salt. The sign of dental calculus is rough surface of the tooth, and the cause of dental calculus is poor oral hygiene. Now the development process of dental calculus. The bacterial biofilm, which is Streptococcus and Actinomyces, attach the cementum, enamel, and other tooth surfaces supported by saliva and also sulcus fluid of gingiva. After 4 to 8 hours, calcium ions bind organic components and calcified. This process occurs from day 1 to day 14. There is two types of dental calculus. First is supragingival calculus. The characteristic of supragingival calculus: first, located on the coronal part of gingival margin. Second, colored with whitish yellow or white. The texture is like clay and hard. And last is easy to remove but very easily to reform. And the second, subgingival calculus. The characteristic of subgingival calculus: first, located on the under of marginal gingival crest, not easily visible. Second, colored with dark brown or greenish black. Third, the texture is like glass, hard and solid. And last is firmly stick to the teeth. This is the picture of dental calculus that attach to tooth surfaces. Now that we have explored the dental calculus, I would like to move on to oral hygiene index simplified. To determine the criteria of dental calculus, use an index called calculus index, which is one of the main index of oral hygiene index simplified. Oral hygiene index simplified is an index used to measure the oral hygiene status of people. Oral hygiene index simplified has two components. First, debris index and calculus index. Debris index is an index that measures food debris on the surface of index's teeth. Calculus index is an index that measures dental calculus on the surface of indexes teeth. These indexes have 6 indexes teeth, 2 representative all the teeth in the mouth. There is the buccal surface of upper molar teeth, 1.6 and 2.6, and the labial surface of upper incisive teeth, 1.1, and the lingual surface of lower molar teeth, there is 4.6 and 3.6, and the labial surface of lower incisive teeth, there is 3.1. According to Greene and Vermeulen, the BASc index and calculus index have criteria. Good criteria, score is 0 to 0.6, medium criteria is 0.7 to 1.8, and bad criteria is 1.9 to 3.0. If bad criteria of dental calculus is not treated immediately, will have negative impact on dental health. I would like to move on to explanation dental calculus resulting in tooth loss. Dental calculus is one of main cause of losing tooth. Dental calculus is hard to remove without the help of dentist or dental therapist. If dental calculus is not treated immediately, it will lead to periodontal disease such as gingivitis. And another statement from Journal of Health Science and Research is there is strong correlation between dental plaque in dental calculus and gingivitis. The untreated dental calculus is one cause of periodontal disease, which can cause mobile and losing tooth. The untreated gingivitis will lead to periodontitis. If it's not treated, it will lead to losing tooth. This condition can lead to compression gingiva or gum, so the attachment of teeth to its pocket are less. The development of dental calculus must be prevented immediately in order to avoid losing tooth. This is 3 process of dental calculus resulting in tooth loss. First is gingivitis. Plaque and tartar or dental calculus inflame the gum and pockets form. Next is periodontitis, pockets deepen. Disease begins to destroy gum, ligaments, and bone. We see that the pockets different from gingivitis and periodontitis. And last is advanced periodontitis. As more bone is destroyed, the tooth is in danger of falling out. Disease may spread to other teeth. The pocket is more open, so the attachment of teeth are less. Preventing the development of dental calculus can be done by 5 efforts. First, brushing teeth at least 2 times a day after eating and before going to bed. Second, using toothpaste which containing fluoride. Third, using dental floss after eating. Fourth, rinsing mouth with antiseptic solution. And last is regularly checking teeth at dental health service at least every 6 months. From literature above, I think a good oral hygiene is becoming a vital factor to prevent the development of dental calculus. Okay, last is about suggestion and conclusion. Untreated dental calculus will lead to losing tooth. Starting with untreated dental calculus, further gingivitis, and furthermore periodontitis. This condition reduces the attachment of the tooth to its socket, or we call it tooth loss. I suggest you to always maintain the oral hygiene to prevent the development of dental calculus. That's all I have time for. Thank you very much for listening. I hope to have been able to show that the effect of untreated dental calculus resulting in tooth loss, and I will be happy to answer any question you may have in column comment. Thank you for listening.